These are my 8 audience members. The Center for Disease Control and Prevention says that 1 in 6 children aged 2 to 8 years old have a mental, behavioral, or developmental disease. Almost everyone struggles with mental health issues at some point in their lives, and if you don't, someone you know does. This is such a prevalent topic in today's society, and it's not talked about enough, so everyone is afraid to seek the help. It needs to be normalized and taught at an early age so that it can be prevented sooner. I have battled with mental health issues all my life, and I was too scared to speak up and get help. At first, I did not even know what exactly was going on and did not know how to try and explain it to anyone, so I stayed very silent. Once I felt confident enough to try and explain how I felt, I was finally able to get the help I needed. It felt so freeing knowing that I wasn't the only one and that I was going to be okay. Besides myself, I have watched my 2 best friends almost lose their battle with depression. I'm going to talk about what types of mental health there are, why it should be taught / discussed in school, and the different types of treatment. To begin, I'm going to elaborate on the differences of mental health disorders. Mental health can be measured on a spectrum, and there's a large spectrum of mental health disorders that range from mild to severe. The mild side of the spectrum can contain anything from anxiety to depression. These are 2 most common and well-known mental disorders, and they contain some of the easiest symptoms to recognize and treat. Anxiety can be part of a genetic and biochemical makeup as well as your personality. This means anxiety can be passed down from family member to family member. There are many things that can trigger anxiety, such as your environment, stressful situations, and/or problems within the family or trauma. If you're experiencing anxiety, you might feel anxious, on edge, or worried most of the time. Feeling overwhelmed, frightened, or even panicked is also common, according to Mental Health, which was published in 2016. Depression is more than just a low mood. It is a serious condition that affects your physical and mental health. While everyone can feel sad, moody, or low from time to time, some people experience these feelings intensely for long periods of time, and sometimes there's no specific reason. Depression can be hard to recognize, but if you feel sad, down, or miserable most of the time, or have lost interest in things that usually are fun for you for more than 2 weeks, these are all signs of depression. On the more severe side of the spectrum, you have anything from schizophrenia to bipolar disorder, and these can be easier to recognize the symptoms but harder to treat. Schizophrenia affects your personal thinking and can alter your perception of reality, their emotions, or behavior. This can be due to emotional causes such as trauma, physical injury to the brain, or the brain's development, or simply genetics. Some of the more recognizable symptoms of schizophrenia are delusions, hallucinations, or disturbances in thought process. Bipolar disorder causes extreme shifts in a person's mood. People with bipolar disorder often have recurring episodes of mania and depression throughout their lives. This disease is known to be genetic and can run in families. Stressful life events can also be cause. Some common symptoms are continuous elevated or euphoric mood, increased energy, and little to needs or no sleep, according to Bipolar Disorder, Biopsychological Etiology and Treatments and its Place on Cognitive Spectrum, published in 2014. Now that you know the different types of mental health disorders, it is important for you to know why they should be talked about in schools. There are lots of children who battle mental health disorders at a young age and can be scared to speak up because they don't know what exactly is going on. This being talked about at school at younger ages will help the children and decrease the stigma around mental health. There are lots of being exposed to this type of environment and discuss can help the children identify issues within themselves or their peers. Most mental health disorders can be present very early in someone's life, but lots of people struggle with identifying the symptoms and seeking the help that they truly need. Children do not often know what their emotions or feelings always mean, so being exposed at a young age and knowing the signs and symptoms can help them know if something is seriously wrong. Small changes in behavior and thinking often occur before mental illness appears. These early warning signs can be noticed by the children or one of their peers if they are taught what to be looking out for. Early intervention can reduce the severity of mental health, and it can also delay the prevention of developmental and major illnesses if caught early. Not only will the students be able to help identify issues, but knowing they aren't alone can make it easier to be open. There is a big stigma attached to having a mental illness, and because of the stigma, people, especially children, are afraid to speak up about how they are feeling because they are afraid they might get made fun of or treated differently. Teaching children what mental health means and how to maintain a positive mental health is a huge in erasing the stigma. It is vital to youth understanding the concept of self-care and responsible for their own mental health, but they also need to know that they are not alone. According to Mental Health Stigma, released in 2015, emphasis should be placed on the idea that mental health is an integral part of their overall health and well-being, and it doesn't make them any less of a person. There are hundreds of treatment options that are offered depending on your diagnosis that range from early intervention. And when it comes to anxiety and depression, there are multiple treatment options. Having effective treatment will help you learn how to control your anxiety so it does not control you. If your condition is fairly mild, your symptoms might be relieved with lifestyle changes like getting regular exercise or self-help strategies, according to mental health that I previously mentioned. When it comes to depression, there's no proven way that people recover, and it can be very different for everyone. There is a range of treatments and health professionals who can help you along the way. For the more severe mental illness, treatments can be limited and restrictive depending on how bad the illness is. When it comes to schizophrenia, the good news is that it's very treatable. People with schizophrenia are usually prescribed medication which target their specific symptoms. There are lots of antipsychotic medications that are now available. For bipolar disorder, there are effective treatments for manic and depression. Often, care and treatment will combine medication and psychological treatment. Overall, you can see that there is a lot that goes into play with mental health. There are multiple mental disorders, lots of reasons for early awareness, and available treatment options. Mental health can be scary and a hard thing to talk about, but being aware and getting the proper help is much more important. The possibility to save someone's life is far more rewarding than staying silent.